A low anterior resection involves removing the rectum and attaching the descending colon to the anus. This surgery is used to treat cancer, non-cancerous growths, or inflammation. The damaged or diseased part of the bowel is detached from the surrounding organs and tissues. The main blood vessel supplying the rectum will be divided and taken with the rectum. Lymph nodes lie along the blood vessel and bowel. These are important for staging in cancer. Next, the bowel is cut and removed. The healthy ends of the intestine will then be reconnected with tiny staples or sutures. The entire specimen is sent to the pathologist, who slices up the tissue to look for disease. As part of your procedure, a diverting loop ileostomy will be created. This includes bringing a loop of your small intestine through the abdominal wall so you will stool into a pouch appliance. There are certain risks and complications that can occur with this type of surgery. This includes bleeding from the surgical bed and surgical site infections. During the procedure, surrounding structures such as the intestines, bladder, blood vessels, or ureters can become damaged and cause problems. In addition, injury can occur to the nerves in the pelvis. This may result in difficulty urinating and sexual dysfunction after surgery. Usually, these are temporary. Additionally, if the new connection does not heal properly or becomes infected, the bowel can leak. This is called an anastomotic leak. It can lead to a serious infection, which may sometimes require insertion of a drain by a radiologist, or rarely, an emergency surgery. You will typically stay in the hospital for 3 to 5 days following surgery. After surgery, you will be able to drink fluids and will be able to eat solid foods the day after surgery. You will be discharged from the hospital when you are able to eat and drink without nausea, bloating, or vomiting, when your pain is controlled with oral pain medications, and after you have learned how to manage your new ostomy. You will be taught how to manage this in the hospital. We will also make sure that your output is manageable so that your risk of dehydration is minimized. Typically, we aim for the output to be approximately 1 liter per day. After recovery from this surgery, which takes at least 6 weeks, you will undergo an imaging study where contrast is injected into your bottom to evaluate your pouch for leaks. If everything looks good, we can proceed with reversing your ileostomy. Reversing your ileostomy involves separating the bowel from your abdominal wall, removing a small portion, and reconnecting the 2 ends of the small intestine. This will allow you to stool from your anus. Risks of this procedure include leaking from the new connection of your small intestine. This may require other interventions to treat. You can also develop a wound infection at the site of the ileostomy. You will stay in the hospital from 1 to 3 days, or until you have return of bowel function through your anus. You may have irregular bowel function after surgery. This is related to your new anatomy, as well as injury to the nerves in your pelvis. This is called low anterior resection syndrome. Symptoms include frequency or urgency of stools, clustering of stools, or numerous bowel movements over a few hours, fecal incontinence, or irregular bowel movements. Because your rectum has been removed, you no longer have the same reservoir for stool that you used to have. If you experience this, rest assured that most of the time this improves with time, and we can assist you with symptom management. Over the next year, your body will adapt to your new anatomy and bowel function will often return to normal.